Discussions in this show should not be construed as specific recommendations or investment advice. Always consult your investment professional before making important investment decisions. Securities offered through registered representatives of Cambridge Investment Research, a broker-dealer member FINRA SIPC. Advisory services through Cambridge Investment Research, Inc., a registered investment advisor. Cambridge and Houston First Financial Group are not affiliated. Good morning, everybody. You're listening to Money Matters. I'm Chris Hensley. We have a great show lined up. I'm taking a breath here because I ran back to my hotel to record this. We are both live out at the Future Proof conference, and they've been running us 90 to nothing. And so she was, nice enough to give us 30 minutes here to kind of pick her brain and tell us about her company Caribou, but then also some of the things that she dove into in a presentation that she did yesterday here at Future Proof. Christine, thank you so much for being on the show today.
Thank you so much for having me. I'm catching my breath a little bit too, as well, from the great event. I heard you kind of stutter there when you were saying conference, because I think they're coining it as a festival. So I think that's what you were considering maybe saying. But it's back to traditional conference with great education. It's been a great event, and I'm happy to make the time.
Well, absolutely. Usually I'll read your bio to the listeners so that they can get to know you a little bit better. And I'll just get the key points, but I kind of gave it away here. I already said that you're the co-founder and CEO of Caribou, and it's a software solution that simplifies healthcare planning for retirees. I know as an advisor, and I'd work with typically 65 and up, that this is an area that tends to be kind of forgotten when it comes to planning. So tell us a little bit more about yourself, maybe something that's not in the bio, so listeners can get to know you a little bit better.
Yeah, so my background's all in healthcare. I never thought I would be attending the Wealth Tech Festival of the world or, presenting to wealth managers and financial planners. But what I very quickly learned working within the healthcare system is that unfortunately, no one is really incentivized to help you plan for or save money on your healthcare costs. And really kind of the impetus of the company is understanding that a fiduciary has that responsibility and incentive to really help drive a lot of that decision making, considering that one of the top expenses in retirement is healthcare costs. So I'm sure we're going to dive into that into a lot of detail, but most of my background is on the healthcare side, working for digital health, medical device kind of startups, and then started my own about 3 years ago.
Nice. And, there's a lot of bad information out there about Medicare. This is not I do this for a living. This is not an area. I think people tend to think, oh, this is intuitive. I'll pick it up as I go. And there's some big mistakes that people can make there. I know Philip Mahler, or let's see, the book Get What Yours Medicare, they talk about, you've got CPAs and attorneys who say, oh, I can handle it myself. And it turns out there's a lot of rules involved with Medicare. Tell us about, the mission and the vision of Caribou and how that fits around that Medicare question and that healthcare question.
Absolutely. It's a black box, right? And there are so many hidden incentives that most people don't understand. I think it's Kaiser Family Foundation that did a study that only 14% of Americans can define an out-of-pocket maximum deductible and premium. So there's a lot of basically knowledge gap out there right now. And a lot of people don't understand the decisions that they are having to make. And it's hard to sort through all of the noise. If you have ever given an insurance company your date of birth and your phone number and your email, they are calling you, showing up at your door, mailing you when you're close to Medicare eligibility, right? So what we're really trying to do is we're cultivating clarity and confidence around a lot of these decisions and making them more data driven, more objective, like trying to break down the incentive structure that is ingrained into the insurance industry when you sell products and make a commission. A lot of people don't necessarily put two and two together to understand how that drives outcomes in insurance. And show me the incentive and I'll show you the outcome, right? It's one of the most common kind of expressions that I turn to because that is what drives insurance related decisions. So what really sets us apart is that we're an objective solution in the market, which is very, very novel and unique no one really does what we do to be able to guide clients through making a very informed, confident decision. Like, that is our mission statement, to be able to provide that experience to clients in this area, just like how advisors do that in other areas of clients' financial lives, right? Like, they are truly ensuring that clients are making informed, data-driven decisions, and so health insurance should be no exception.
Absolutely, absolutely. I know personally the clients I have, it's healthcare is, I would say, almost like a stepchild of planning, right? A lot of advisors are just not bringing it into the plan. So, and we have two different, audiences who are listening to this. We have people who are near, just consumers who are listening, who are looking to retire, and then we also have other advisors out there who need to know about something like this, to need to know about this tool. You've talked before about the healthcare gap. Can you tell us a little bit, I guess, from both perspectives of, as an advisor, if I'm looking to bring something like this in to help me, but also how that would help the client and fit it in with that healthcare gap there? Maybe explain what that is.
Yeah, so typically a gap period is referred to the in-between portion of somebody's life where they retire and then they become Medicare eligible. I've heard from many, many clients that one of the reasons that they keep their job longer than they need to is to bridge that gap. Or they wait until at least COBRA can take them the full way, that 18 months to Medicare eligibility. And for anyone who's not familiar with what COBRA is, it's a continuation of your employer benefits, but that's only available for about 18 months typically. And it is often very, very expensive coverage because you're paying 100% of the premium plus a 2% administration fee. So a lot of people are just afraid of what other options are out there, or there's a lot of misconception. For example, I hear that people still don't know that you won't be denied for pre-existing conditions, or they think they don't qualify based on their income for the marketplace. The marketplace, which is healthcare.gov in most states, or some states have their own individual insurance markets, like California, Covered California, or like Pennsylvania with Penny, for example. Is available to anyone so long as you're a US citizen, and you can even access a premium tax credit depending on your income. And most people who are retired don't have that salary anymore, and so they qualify for a premium tax credit as well. And you can find insurance for yourself as well as your family if you have a spouse and kids to cover too. It is typically quite expensive in comparison to your employee benefits, but it does give you that flexibility where you don't need to hold on to your job all the way through to Medicare eligibility. And it is a good option and can provide good coverage depending on what you're looking for. So we help clients or advisors walk their clients through that and understanding the healthcare costs associated with it, because it is a lot different than your employee benefits, both in the form of premiums and in the form of out-of-pocket maximums. We see some families spend $25,000 a year in premiums on the marketplace, as well as the out-of-pocket costs might be up to $17,000, $18,000 if you're on a bronze plan with a high deductible, maybe because you want to contribute to an HSA, for example. So there's so many different factors that go into making an informed decision. But what we're truly doing is making sure clients know that they don't have to hold on to their job all the way to Medicare eligibility or 18 months from Medicare eligibility. There are other options out there that can give you a little bit more freedom and retire early if you have that available to you.
I love it. I love it. So I know from personally for the clients that I have, it can become very complicated. I mean, you've got people that they're so used to the employer sponsored health insurance plan, and then when you transition either to Medicare or a supplemental or something that's in the private market, or either what's in the federal healthcare marketplace, it's different, right? It looks different than what they're used to. So helping them understand that. Do they have retiree healthcare insurance at their employers? Some of my clients do, and they're the lucky ones, right? And then some of them they don't. And then if you're trying to coordinate the spouse and how if you're retiring early, that can become like a big math problem. It could even be more important than the investments. And healthcare is huge. It's super important. Tell us a little bit about how, from the advisor's perspective, when I put my advisor hat on and I'm wanting to use a tool like Caribou, how does it make my job easier?
Yeah, so most advisors, quite candidly, have not been doing this in-house. They've been referring the business out. The risks, I guess, associated with that is if you're referring the business out, you have no oversight. into that experience, right? So you don't know the quality of the coverage that your client might be recommended. You don't know what incentives are possibly driving the products that are being sold to the client. And there's also no tie back into your financial plan. A lot of advisors tell me I refer that out. And so I ask them, what does that healthcare line item look like then on your financial plan? And they say, well, we use estimates. Well, you should be asking your client what they're spending, what their premiums are, what their out-of-pocket maximum are, and put that into the financial plan. So there's no feedback loop with that either. That's really the only thing available to advisors today outside of becoming a healthcare expert yourself and doing all the research and formatting a deliverable and talking to your client about it, which I would not recommend to advisors, okay? I never expect advisors to become a healthcare expert. If you want to, that's fantastic. However, I don't think your clients really want you to be a healthcare expert. They want you to be an expert on their investments and their financial plan and be kind of like a conduit to great resources in other areas of their financial lives. So bringing that in-house can be scary. What we do is we kind of act like a back office where you as an advisor create the client account. Client is the one entering all of the data that we need. So you aren't going to be in the business of asking your client for what medications they take or helping them with any of the data entry. It's going to be the client that's doing all that. And then we conduct the analysis and we send it back to the both of you with great summary notes that you can reference if you want to drive the conversation with you or your client, or you can rely on us to walk you and the client through the results of the analysis. So that's what it looks like to kind of bring it in-house today using a software like ours.
Nice. I know for retirees, that's who I'm working with. I'm switching from advisor back to the retiree role here. But for retirees, they have some unique roadblocks, right? I mean, there's IRMA for that. If they hit that fiscal cliff and they're highly compensated and they make some mistakes, they could end up, paying the highest premium on Medicare down the road and didn't even know they kind of got into that problem. Do you have any tips for retirees, maybe some actionable things that they can do to really help them make a better plan towards their healthcare costs?
Yeah, certainly. I can kind of name a couple. So just because you referenced IRMA, for example, if um, the difference in the salary or investments or the sale of a home or something like that is going to be massive, don't try to play around with IRMA. Like the difference in IRMA annually is a few $1,000s up to I think $10,000 at most. So typically it's not a game that you really want to play around with. If you are going to pay higher in premiums, it's likely because you had some big payout or something happened, your salary was much larger and it's not worth playing around with. However, if you have had a significant drop in income because of a retirement, for example, you should appeal that income adjustment via IRMA, right? Like don't think that you are subject to that. If you have had that life-changing event, you can actually work with Medicare to appeal it. So don't overwrite the ability to possibly modify that. So be sure as an advisor or as a retiree that you are either advising your clients or you yourself as the client or retiree are on top of that, that you can possibly adjust the Part B and Part D premiums that you are subject to based on your income from 2 years prior. Also, here's another one for pre-65 retirees. If you are retiring early but are still relatively healthy, look at a high deductible plan option, look at contributing to an HSA. You can pull money from your HSA to pay your Medicare premiums in the future, which is fantastic, or just use it as a tax-free growth vehicle for your investments. HSAs are fantastic, but what you really want to make sure you're considering is that you will have a high deductible. And if you are on a high deductible on the marketplace, that typically means $10,000 and above. Usually $14,000, $15,000, $16,000 is what we're seeing those bronze HSA compatible plans come in at. So that looks very different than your employer plan where your high deductible was maybe $3,000. I think that's the average amount of a high deductible plan for your employer where you could access and contribute to an HSA. If you're 64 and going onto the marketplace for the first time for 12 months, probably not worth setting up an HSA, but you could plop, a good amount of money in there and have it grow over the course of your retirement if you wanted to, but definitely something to consider if you've been contributing to an HSA and are comfortable with higher deductible plans and have been contributing to one for a number of years.
And if you're a employee of a company that they've gone out and they've kind of gotten you the Cadillac health insurance policy where there's no deductible, you need to know that there's going to be a sticker shock after that if this is going to be your first time with that. Tell me a little bit more about some of the key life events that might trigger a reevaluation of healthcare costs in your insurance options. Are there certain life events that make us look in a certain direction?
Absolutely. The big ones, retirement and Medicare eligibility, most certainly that's where we see a lot of our client interactions being surfaced. Another great one is open enrollment. So we're recording this in September. Open enrollment is around the corner. It starts in October for Medicare and then in November for the marketplace. So that is a great touch point for advisors to have with their clients or just clients to remember so that they can reevaluate their benefits for the upcoming year. It is the only time of the year where you can change your health plan. So it's a great, great, great opportunity to do that. Throughout the rest of the year, birthdays, moving, if you're relocating, it's a qualified special enrollment period. If you are going through a change in marital status because of a divorce, for example, or you are widowed, those are other life events definitely to keep in mind. And another one that I really love, which introduces the advisor to the next generation to start to demonstrate their planning capabilities, is when the client's children are aging off the policy at 26. So it's a good connection point to make with that next generation, with their children, and show them that you could help them with a variety of different planning areas like healthcare, get them on a health plan through typically the marketplace. Usually they're graduated from school, so they don't have student health plans available to them, but they might not be employed full-time yet or have benefits accessible to them through an employer. So it's a great way to kind of show that you can help them with planning in some of these value add areas.
Awesome. That's really good ideas there, and we come to find out that people, they aren't worried about this stuff until these life events happens, and that's a trigger to make them go back and look at it. So pointing those milestones out is good for the clients, but it's also good for advisors to know, who are looking at this and wanting to see if it's something that will be helpful to them. So I'm going to switch gears on you because yesterday you gave a fantastic presentation on AI, which you admittedly said, I'm not an AI expert, but, and then you proceeded to give a really good talk on AI there. You had some funding for your company, right? Tell us a little bit about that and who helped kind of fund the company, how that happened, and tell us a little bit about that.
Yeah, it's something I'm really proud of. Only 2% of women founders raise venture capital, or the venture capital dollars have only gone into 2% of women-led companies, is another way of kind of saying that. So I'm really proud that we've put together multiple rounds of funding. We've raised to date close to $4 million. So we've got a great team that we've been able to hire because of that, and we've been able to focus on a lot of operational engineering efforts with that injection of capital. I think that a lot of alternatives in the industry are simply like consulting businesses, but what we've done is we've been able to kind of automate that whole process and provide a much more scalable solution to advisory firms that have offices across the whole country, thousands and thousands of clients, which consulting services unfortunately just can't service because you need to always add people to grow that. So what we've been able to do with the funding is really focus on engineering and building software that can provide these data-driven insights at scale across the whole country, but also still have a human in the loop the whole way. Healthcare is very highly personalized, highly human. People want to talk to a representative, so we've been able to balance both really effectively, and we have fantastic investors that are mostly operators themselves. They span backgrounds in finance, backgrounds in healthcare. So we've got a great cap table that kind of has a little bit of both together. And I look forward to bringing on future partners in the rounds that will come in the future. But we've got a really great growth trajectory trending well towards profitability as well. So might be able to be independent of that in the future too.
I love it. I love it. And it's such a good idea. And to see, money spent in that direction, it's something that will help clients. It will help advisors. So I'm going to just do a quick commentary here. Yesterday, as a also a public speaker, right, that goes out and speaks in front of the audience there, they've got Future Proof so slick that when you're given the presentation, there's a little app that people can ask questions on, right? And so at the end of your presentation yesterday, you asked if there's any questions there. And I've seen other presenters on the stage, if nobody's asking questions, they just die on the stage. And you knew to go and ask to get audience participation and actually get people to ask real life questions. But what I thought was funny is you said, is it okay to ask questions? And I looked, and the production people in the background, they had on headsets and they were going, no. And it was only because you were throwing them off of kind of what they, whatever they thought they should be doing. But you just gave a presentation on being present and the human aspects of AI and how you need to kind of be in there and get in there. So it was excellent. I thought you did a good job, especially for the technology sometimes can be a roadblock there when you're present and speaking and stuff there. Anyway, just high five on that.
Well, maybe they won't invite me back to speak next year because of it. I didn't see them waiting or telling me no, but I like to think that there were no questions through the app because everyone was just so drawn in to the presentation. So no one submitted them via the app, but people threw their hands up. So I said, why not? Let's see what the crowd
that's the sign of an accomplished speaker. You're not going to get stopped out that. You're going to get the audience to start asking questions. So I thought that was really awesome there. So I could sit here and talk to you forever on here, but we're actually hitting the towards the end of the show. Is there any, before we go, I'd like you to kind of give us the website for people to want to find out more about you and about the company. But also, is there anything that I forgot to ask you that you'd like to leave listeners with today?
Yeah, that's a great question. I would say if you feel like you still have more questions about healthcare planning after listening to this podcast, take a look at our website, which is caribouwealth.com, and take a read through some of our case studies. We've got great success stories at other firms. We have great guides. We have just really good content that outlines like what the actual experience is and what the client testimonies are that we get. Because I guarantee you that when you introduce this to your clients, it's going to be your clients that are driving more utilization of the product because they're going to make comments like, now I can make a clear, confident decision. This was so confusing to me beforehand, and now I have insights into exactly what to do. I did all this research, and now it's clear to me. And that is the type of experience that as an advisor, you should be wanting to drive. And so you can see a lot of that on our website via the blogs, the case studies, the success stories. It's all there. And if you have any lingering questions, book a call with our team. Reach out to me directly on LinkedIn or via the website. I'd be happy to chat further about your current process, what that looks like, and opportunities to hopefully make it better.